Hello, it's Dr. Rachel Brown, Medical Director of Prevention and Wellness with Employer Health Services at Prisma Health. And this is your quarterly Employer Health Services newsletter video. Today, I want to catch you up on everything that we're excited to share with you in 2024. I hope that everyone had a wonderful holiday season and is excited to start the new year with new resources and new support for you and your employees. So, I want to talk to you first about our consultative services. Of course, we have always worked with clients to meet their needs and reveal trends and preferences among the workplace around well-being and health. But we have now a more formalized consultative service that includes needs assessments, formal needs assessments, gathering up of inventories and being able to connect the dots on the resources that you already have, along with the resources we can provide, and then recommending strategies, services, workshops, incentive plans, whatever it is that you're interested in exploring. Our experts can help you work with your team of wellness champions to know what would be best for the year for your employees. So very robust and more intense consultative services coming out. We also have our direct to employer advanced primary care practice. Our first one opened up last year in Greenville. We will be opening up one in the Midlands area in Columbia in March. And this is the direct care that we're seeing growing across the nation, where folks can receive comprehensive primary care in one setting with a dedicated primary care provider for a flat cost. And in this case, the employer pays a PMPM flat rate for their employees to receive comprehensive care on site at our offices, but also video visits, telephonic visits, messaging. We can do home visits. We can visit your work site. We can do group visits. So every modality is available to you. Now, included in that comprehensive primary care package are common labs and medications, also covered with that flat monthly fee. But the advanced primary care piece of it is what gets me really excited. And this is the piece where we take a look at your population and identify the health trends that need to be addressed, and address them on the front end. Instead of waiting for employees to come to us, we want to figure out what do your employees need and work to maybe close the gap on breast cancer screening, close the gap on making sure diabetics have seen an ophthalmologist, whatever that gap may be. We want to use those population health techniques to take the best care of your workforce. Now, our on-site clinics are absolutely still an option. They're going strong. We get incredibly positive feedback, and our staff working in those clinics becomes part of your work family, and your folks consider them first-line healthcare providers for them, which is wonderful for us. So we'd still be delivering that episodic care. We take great pride in navigating folks into primary care and assigning them primary care physicians and providers if they don't already have one, as well as connecting them with other resources within your organization, other resources we offer, and other resources in the community and our healthcare system at Prisma Health. We make sure that we coordinate care, and we're there for labs if that's an option that you'd like to take us up on. We're seeing more and more clients utilize us for what we call enhanced screening visits, where folks can have a one-on-one wellness visit with a provider and make sure all those healthcare gaps are closed and all the appropriate labs are ordered. And we're also becoming more robust with our cancer screening initiatives. So we've partnered with mobile mammography with many of our clients. We'll continue to do that. We're working with Cologuard for colon cancer screening and also exploring some other cancer screening opportunities such as lung cancer and esophageal cancer. Now we have our robust wellness support. Of course, they can do wellness screenings for you as always. We're increasing the goal setting approach with our health coaching. We've always set incredible goals for anyone who's receiving health coaching, but we're formalizing that process to help you so that we can report out not on folks' specific goals, but just on the types of things your population is working on as a whole and the types of outcomes that we're able to measure as those folks meet their goals. We continue to have our wellness programming, which we have revamped to include the most up-to-date information, but also to be as effective as it can be in person or virtually, or both, if you want to do classes with both the types of attendees. So our Lose Well class is for weight management, Choose Well is for managing nutrition and healthy balanced meals, Fit Well is how to get moving and how to do that at work and fit it into your routine. Mind Well is our comprehensive well-being program that focuses on emotional well-being through all of the wellness dimensions. And Quit Well is our smoking cessation program. Now, all of these programs are about 4 to 6 weeks in length, where groups meet 1 hour at a time each week. And that group support is a big part so successful, in addition to our excellent instructors. We're working on adding in a component where once a participant completes the WELLS course, that we have a 12-month-long follow-up period where we continue to work sporadically and episodically with each of the participants to make sure that they're sticking with their goals. And we are finding in the literature that that's really the best way to make sure that folks make long-term and persistent change. We have support resources that we can help you to engage with. We've got the Navigate Wellness Portal, which we use here at Prisma Health and is an outstanding way to provide information, tracking, challenges, incentives, and other messaging to drive a culture of well-being within your workforce. We also have partnered with TELUS Health to provide employee assistance programs. You may recognize this. They were formerly LifeWorks, and they, of course, provide 24/7 access to short-term focused counseling, as well as a digital platform for autonomous work on emotional well-being and other virtual options for folks to maintain their emotional well-being and their mental health to the utmost. We're very excited to be formalizing our measurement of metrics approach. We want to be sure that we are showing that we make incredible differences in the lives of your employees through any of our services. And so we have been working with our incredible data analysts to figure out the best way to use the information we have to tell you the story of what's going on with your workforce. And that includes the impact and the trends, impact of our services and the trends among your workforce in terms of their health, but also includes patient satisfaction and employer satisfaction. How do you feel that folks are doing? And both of those aspects will help to inform what makes the most sense going forward in terms of strategy for your workforce. So, got a lot going on in 2024. We have taken all of our services and elevated them because we know that you feel that taking care of your employees is important, and that you are putting a priority on creating a culture of wellness. And we want to support you in every aspect of that, whether that's through consulting, healthcare, direct primary care, episodic care, as well as wellness programming, and just support, giving you the information you need to know so that you can make the best decisions about what is best for developing a happy, healthy, productive workforce. So please reach out to us. You can go to our website. All you have to do is search Employee Health Services at Prisma Health, and you will reach our website, and you can hit the Contact Us button and receive a call or an email, whatever is more convenient for you, to discuss our services further. In the meantime, I hope that the start of 2024 is wonderful for everyone. We look forward to hearing from you. We're here to take care of you so that you can take care of your workforce.